Welcome back to Hot Flashes and Cool Topics. Today, our guests, we are going to have such a great conversation about mental health and menopause and midlife. Our guests today are Jill Angelo, who is the founder of Gennev, and Dr. Yashika Dooley and Stasi Kasianchuck. Welcome to the show today, guys.
Thank you.
Thanks for having us.
Hello, thanks.
Well, we're excited to talk to you, but I kind of want to start with Jill because Jill, you were on the show a couple of years back, kind of in the infancy of Gennev, and Gennev has grown so much. And Bridget and I love watching the evolution of the company. Can you talk a little bit about what's happened? You're now on the Aetna network, and then we'll get into talking about your partnership with Lifestance.
Yeah, absolutely. It's great to be back, and also fun to see how much Hot Flashes and Cool Topics has grown too. So congrats right back to you. You know, I think Gennev has grown with the rise of the menopause conversation. You know, I remember years ago when no one was talking about it, and we had to even educate people on what it was. And so we've just kind of, it's been a rising tide floats all boats sort of mentality. And in the last, 12 to 16 months, not only have we really grown our team nationally, we're now supporting women with integrated menopause care led by OBGYNs and registered dietitians, and we're supporting women in all 50 states. But we've also started to improve access to this quality of care. We truly believe that for women to thrive through menopause, they need specialists that understand their care and are treating menopause symptoms at the root of what's happening. So we've expanded our ability for women to access our care through insurance coverage. We are now in network with Aetna, again, in all 50 states. We're starting to see Aetna backed companies send their employees to Gennev, and it's wonderful to see working women have their healthcare covered and coming to Gennev. And then also we've started to forge, I think, some important partnerships. The one, and I know we're going to talk a little bit about it today, is really serving women and their mental health and behavioral health needs during menopause. It is a time where depression can be exaggerated if you've suffered from that in the past. Anxiety and mood swings are at an all-time high. And so back in May, we announced a partnership with Lifestance, which is a very large public mental health therapy company that offers both virtual and in-person care with therapists throughout the United States. So it's an exciting time, and that just adds another layer of our care model. So women can come to Gennev, meet with an OBGYN, a dietitian for lifestyle care, and then also a mental health therapist through our partnership with Lifestance without having to navigate that on her own.
Well, I was going to ask our other two guests as well, just, different roles and what they do with Gennev. So I will start with Dr. Dooley. If you could just share a little bit about your role with Gennev.
Yeah, so I actually started as a consultant with Gennev a couple of years ago. Just I do urogynecology, and so was just really talking to them about like what I know as far as menopause and incontinence and all of that. And then in this past year, I retired from the military and I came on as one of their providers. So I have the privilege of actually taking care of our patients and helping them just to grow their physician team.
And then Stasi. No, I was going to say it's Stasi.
My background is I'm a registered dietitian and exercise physiologist, and I came on board pretty early on, back in 2019, 2020, when we were first starting the lifestyle side of things with health coaching. And so as a registered dietitian, I had training and as well as my team around health coaching aspects, as well as the lifestyle strategies to really support women in managing their symptoms and thriving during this time of life. So as dietitians, yes, we focus on nutrition, but I like to think of it that the nutrition is kind of the gateway to all the other things that come up around that. So we also focus on movement and sleep and stress management, looking at mindfulness, a lot of different factors that play into overall mental health. And so that's where my team and I play a role. And we are some of that thread, I like to think, between the physicians. So we work very closely with our physicians in our integrated care model. We can communicate communicate with them if needed. And we see our patients about every 2 weeks, we find is most effective. And so with the physicians seeing their patients about every 3 to 6 months, we're kind of that interconnected tissue in between those appointments to make sure that the patient stays engaged and gets the care that they need and deserve.
I love that you're talking about a comprehensive care package, because so many of our listeners say, I don't relate to just hot flashes. I don't get just hot flashes, or I can't sleep, or I'm gaining weight, or it's so many. Every time we say there are this many symptoms, they add more symptoms on. So the mental health component is a big one for a lot of our listeners. And for me, it was huge in menopause. Dr. Dooley, can you talk when you see patients, how often do they say, I'm a little more depressed than I used to? Do they even recognize that it could be a symptom of menopause?
I don't think that they initially recognize it. I think oftentimes when I see them, their symptoms have been minimized by others. Nobody has really listened to them. And so sometimes they're just like, am I crazy? Is this a real thing? I keep telling people and they keep acting like, I shouldn't be worried about it. So I think they are then almost questioning themselves and what's really going on. And sometimes they've been told by doctors that there's nothing that can be done and that they just need to kind of deal with it. And so the first thing for me is just to really acknowledge, yes, everything that you're feeling and experiencing is real. It's true. You're not crazy. And there are things that we can do. I think oftentimes the way that people present is that they'll say, my family says I'm really moody. My family says they can't talk to me. My family says I'm on edge. They don't always notice it. They feel like they're more stressed out or maybe anxious or there's a lot going on. But oftentimes it's their family maybe that's telling them X, Y, and Z. Very few people will come in and be like, I'm depressed or I'm overwhelmed. It's just, they feel like a lot of the relationships, both at home and at work, feel very strained.
And
go ahead.
Sorry,
Go
I
ahead.
just wanted to do one follow-up with that. Dr.
Sure.
Dooley, a lot of women are told to go on an antidepressant for, menopausal symptoms, and they're hesitant to do that. I know Bridget was given Effexor as for her hot flashes, but sometimes it's necessary to go on those antidepressants or other medicinal help for anxiety, for depression. Do you see women kind of push back against that idea?
I see women push back when they don't feel like they're a part of the conversation. And so I think one of the things that we do is we want to really just flush out, what are your symptoms? How is it impacting your quality of life? And what are you interested in, right? So when they know that I am going to help them do whatever is best for them, then they're totally open to talking about all the options. And my thing is, I don't have to lead with medications if that's not what they're interested in. I usually ask them, what are you interested in? What would you like? Where do you want to start? And if they say medication, then that's where we take the conversation. But if they're like, you know what, can you tell me some alternative therapies? What are some other things I really don't want to start with medicine? Then I'm like, okay, let's talk about some of the behavioral therapies that are available. Let's talk about getting you in with one of our registered dietitians. Let's talk about Lifestance. Because there are other things that they can do. And I let them know that all of them can work together. But if there is not buy-in from the woman about what's best for her, it's never going to work.
And I think that's so great too, that to hear it from a physician to say that to them, because I feel like so many women are, like you said earlier, dismissed when they go to their physician. So it's wonderful to hear that. When I was looking at Gennev's website and the partnership with Lifestance Health, it was really just fascinating to see all of the components coming together with it. And what I was fascinated about is how it really starts with perimenopause. So do you mind, Jill, talking a little bit about how mental health and perimenopause and how that all kind of starts there?
Yeah, I think the average age of our patient is about 49 years old. So we're seeing a lot of women in their 40s coming to Gennev. And that's when, just to quote even Dr. Rebecca Dunsmore-Sue, our chief medical officer, that's when oftentimes some of the symptoms are the strongest. Anxiety really rises during that time. And additionally, it is the first transition from what you knew of yourself and your health to something new. And so there's a lot of questions and unanswered questions around what's going on with me, which can only heighten anxiety that you might already be experiencing that's really driven by the hormonal shift. So when we think about kind of the type of women that we're seeing most often, and that we really feel our partnership with Lifestance can support, it's really women during that perimenopausal timeframe, just because, again, greatest amount of change, most severe symptoms, specifically related, I think, a lot to anxiety, among others.
Stacey, let me ask you, Dr. Dooley talked about the fact that there are other options, and we're going to get into lifestyle in that conversation. And one of our prior guests, Dr. Ellen Vora, who wrote The Anatomy of Anxiety, talks about false versus real anxiety. And she refers to false anxiety as maybe your blood sugar's low, maybe you haven't been sleeping, and all these things that can exacerbate your already high level of anxiety. Can you talk a little bit about what you recommend to women who may be feeling more anxious, depressed, kind of on edge, maybe a little rage, that they can change in their lifestyle that'll help?
Absolutely. Yeah, I like how you brought up the blood sugar component. I don't know that a lot of women realize that. And blood sugar regulation changes during the perimenopausal transition in terms of women tend to become more insulin resistant. And so there's a shift that's happening there. And so educating women on the types of foods and when to eat them can be helpful in keeping a blood sugar more steady, so that they avoid those dips and then those highs. So, for example, the typical recommendations that we are always giving our patients when it comes to nutrition is to combine a complex high fiber carbohydrate, so your fruits, your vegetables, your whole grains, things that we've all heard, right? Nothing new here, but with a protein source and in a healthy fat source as well. But that combination becomes, I think, even more critical with women during this time, especially if they are working with anxiety or depression or other mental health concerns that perhaps the volume's been turned up a little. So on a nutrition side, certainly that's something that we're talking about. And also nourishing their bodies with a variety of whole foods that provide the vitamins, the minerals. Protein is one. For the amino acids that make up protein, they have roles in neurotransmitters in the brain, for example. So if we're thinking about the mental health concerns, brain health is one concern, but mental health as well, we want to make sure that we're providing the nutrition that's necessary. And that's something that's done long term. And so that's where our work consistently with our patients typically isn't going to happen overnight. But if we can help them make small changes over time, and to Dr. Dooley's point of getting buy-in of what's realistic, a complete overhaul is never going to be realistic for most women during this phase of their life. But small changes where they have the wins, they feel successful, which also feels good for mental health, right? When we do something that we feel good about, I did that, then we can build on those things and make progress over time on the nutrition side of things from one of the lifestyle factors that's helpful.
And then also physically moving, what kind of different physical things can play a role in that?
Yeah, so we, again, it's looking at what is accessible to someone, but getting them out and moving. And you know what I find, certainly we know the benefits of exercise related to brain health, endorphins. Certainly there's research to support that consistent exercise over time, both cardiovascular and strength training, even flexibility that supports mental health. But with this patient population specifically, that is time they are taking for themselves. This population does not take time for themselves. They haven't. And that during this phase of their life, more patients than I can count, when I have said, what do you need right now? The answer is, I don't even know. And so when you can help them to understand, hey, let's try some movement, let's find what works best for you. Not only are they getting the benefits of exercise, when they can set that boundary for their family or work or whoever it may be, that I'm doing this for 15, 20, 60 minutes, the feeling that they have when they come back from that, it's not necessarily they're like, oh, my mental health feels better because I also took this time for myself.
That leads me to a question with Jill. Jill, when you started out, did you want to get a mental health component to Gennev? And if so, Was it a problem? Did the insurance companies, give you a hard time to add that? Because a lot of insurance companies don't want to cover mental health. And so my first question is, did you have trouble with that? But then also, why Lifestance? Like, why did you choose that company to go with?
Yeah, I think first and foremost, when we started just in our care model, we kind of went after the basics around, HRT or no HRT. I think one of the nuts and bolts of our care model is we know that whether or not you're taking hormone therapy or another prescription medicine, you're also going to need to make some lifestyle changes. And so that's why our models led with, Dr. Yashika as an OBGYN and Stasi Kasianchuck as a lifestyle coach and dietitian. When we decided to also add mental health, it was because it was coming up most frequently. Women were asking for referrals to therapists, to a psychologist, to a psychiatrist. We kind of judged, okay, where do we go next? Weight management, mental health, some of the bigger areas that commonly women really struggle with. And with behavioral mental health being such a big request, we went on and sought out a partner and a provider. We chose Lifestance for a couple of reasons. Number one, they already had the insurance coverage. So they did that hard work. And if you will, mental health is kind of a good parallel to menopause care. It is highly stigmatized. People didn't talk about it. And now companies and insurance providers, they're all starting to cover it based upon just a growing need amongst the population. And I think the pandemic really spun that out. Menopause now is on that same trajectory where we're starting, it's a large population and payers and employers are starting to pay attention. So if there's a playbook for getting your care covered, it is mental health for us. And we went to Lifestance because they've already walked that journey. So that was reason number one. Reason number two is they offer both virtual and in-person care. They started as an in-person care mental health provider, now encompassing 34 states. Now they've partnered with other organizations to have a broader reach throughout the US. So they had a good footprint, but then during the pandemic, they quickly had to pivot like so many in-care practices did to also offer telehealth. And they've got a hybrid model now that works really well. In that model, we felt that best serves our patients because we can start with the virtual care because we're 100% virtual. But if that patient needs to be seen in person, they've got that capability too. I'd say the third decision point, our clinical teams needed to align around their own beliefs around treating and caring for patients. Lifestance sends women our way. They've got a lot of women who are struggling with menopause that have come to them for mental health. So it's a really two-way relationship. And our clinical teams are continuously educating one another. They've invested in even training some of their therapists and providers on menopause care and likewise. And so there's just such a partnership there on the care team level. And again, there's so much more we can do together, but it's been a great partnership so far.
Dr. Dooley, I was wondering if you do prescribe menopause hormone therapy to a patient, do you see an improvement in any of their mental health if you do that?
Yeah, I definitely think they start feeling a lot better. I mean, I think some of it's definitely from the prescription medication, the hormone replacement. I think also it is being able to have that conversation. It just helps to relieve their anxiety, to acknowledge that their symptoms are real, right? It just helps them to feel like, okay, I know myself and this really is happening. I think also it is as their symptoms start to subside, right? They're not having hot flashes all day. They're not having all the vasomotor symptoms at night. So now they're able to get a little bit more sleep. And so now they're waking up a little bit more well-rested. They're not having as much brain fog. They can have better conversations and better relationships. And then I usually talk to my patients also about like, can we get you in to see the registered dietitian? Because I know that there are often other things that we can do, right? Like, how can we maximize getting out a little bit more, your movement? What are you eating? Like, I know that all of those things impact so much how they feel during the day, right? And so I want them to be able to have all the information and advocate for themselves. And the more information I can give them, the better that they're just going to feel. So, I mean, I feel like most of the patients, it's like, I think the Gennev data is like 92% are feeling better after that first visit. But even just as they're getting off the phone, just being like, oh my God, somebody took the time to listen to me, feels amazing when nobody has listened to you for years and years.
Yeah, I agree. And I'm somebody that is on menopause hormone therapy, and it has made me feel better. Just one of the people.
Just one of many.
If I can add on to that point, to what Dr. Dooley just mentioned, and Bridget, you as well. This week, in fact, we're releasing a study that we conducted. We commissioned actually a third-party actuarial firm, Milliman, to conduct. And really, the study is all around what's the cost. What are the costs that menopause are driving within the healthcare system? And so in many ways, what's the cost of not treating it? And you'll see in that data as we publish that report, there is an increase of 47% in costs for women who have been who are suffering from menopausal symptoms compared to those who are not. So 47% increase, and that's across a range of pharmacy, outpatient, inpatient services. But one category of care is behavioral health, and obviously where costs are going up. And we also looked at, and we split the women into cohorts, women who are on HRT, women who have been diagnosed with menopause who are using other therapies. And the women who were on hormone replacement therapy had a 14% decrease in their behavioral health costs to the healthcare system. So there is some truth, even in terms of claims data around how, hormone medications or hormone-based medications or menopause care and therapy can start to decrease behavioral health care costs that are on the healthcare system today. So we look forward to sharing more. Maybe we come back and talk about that as another episode in the future. But I just thought that was an important adjunct onto what Dr. Dooley just mentioned around the value of HRT for women who can take it.
Right. And that's, another thing, women who can take it. So follow that, Dr. Dooley, women that can't take it. And I know that kind of plays into everything, Stasi, with what you do. Those are things that could come into play. Where would you start, Dr. Dooley, if the woman can't take hormone replacement?
And what do you think of Vezo? I would ask her also.
Oh, yeah.
The new FDA approved treatment.
I think that if a woman can't take HRT, there are still a lot of things that can be done. So I start talking to them about, cognitive behavioral therapy and movement and all of those things. Because a lot of times they didn't even realize that they were available and that they could be so helpful. And so I think that's, just one small part of it. And then even just being able to talk to a psychologist can be helpful, because there are women who are like, I really don't want to go on medications. I'm like, that's okay. You don't have to if you don't want to. But just being able to talk about what's going on, what are the barriers, where are you getting stuck, where are the places where it seems like you're getting the times when you're anxious or frustrated or whatever, right? It's like, how can we talk about those times, and what are the ways that you can be able to deal with those symptoms?
What do you think of the new FDA approved non-hormonal treatment?
I think it's going to be great for women that can qualify for it. I think also it's going to be payer issues potentially. There are the costs that I have seen, it's not always covered, or it's only partially covered, so it can be quite expensive. But I think for women that can qualify for it, I think it's going to work really well. The data shows that even if it's a 50% decrease in their vasomotor symptoms, so if a woman is having 12 hot flashes a day and now you can take it down to 6 or 5, it just gives them so much more flexibility and relief in their life, where they can focus on other things and not have that be the constant thing that they're worried about.
Okay. And then Stasi, with someone who can't take hormone replacement, where would you start with someone like that to help?
Well, it depends on what symptoms that they are most extreme. But if we're thinking on, some of the Sometimes with something like hot flashes, certain things, identifying triggers. So just going through the day, tracking, figuring out when they're having them, identifying certain triggers. Some women do notice that certain foods may be triggers, or certain times of day, or if it's more environmental, can they change their sheets, I often will talk to women about getting a small fan, putting it next to their bed, or there are even things like the chili pad that you can put that's just on one side of the bed that can help to just bring that temperature down a little bit in the room if it's something around the night sweats that disrupt the sleep that then further can impact anxiety or depression or other mental health concerns. Certainly, if it is, again, the mental health piece, similar to what Dr. Dooley recommended, where there's a fine line in terms of the scope of a dietitian. We aren't therapists, so we can certainly put together the tools to help people put things in place, those helpful strategies like we talked around exercise or nutrition, or say a mindfulness practice. I do find that helps for a lot of women, and there's data to even support that 1 to 2 minutes of focused deep breathing can activate that parasympathetic, our rest and digest side of our nervous system that does not get a lot of love. We are fight or flight, right? That sympathetic nervous system is active all the time. Both are important, but during this time when there is a little bit more stress on the body, I always explain to women that menopause is a normal, natural change for the body, but it still is stressful. The body likes to be in homeostasis. Hormones going up and down, it's not homeostasis. So the body's trying to work with that. So if we can help provide those tools that are realistic for someone to implement around mindfulness and being able to put that in place. The other area that I was starting to talk about, as Dr. Dooley recommended, we will also provide the referrals. We can refer to our Lifestance partners so that when there is an area where someone may need to dig deeper into their mental health concerns, we can also provide that referral. And it can be a great relationship, as Jill described, between the physician, the dietitian, and the therapist to really be hitting all angles for that patient to help them to be successful and just feel so much better.
Jill, I know that you have done so much work with Gennev, and it's such a wonderful platform. What is the response? We get a lot of emails from women saying, I don't know where to go. Is my doctor going to be a good doctor? Does this person, are they NAM certified? How have you gotten the word out on Gennev? What do you find most effective in getting to our demographic of women? Is it social media? Is it working with companies like Lifestance? What works for Gennev?
Initially, it's kind of changed over time. Initially, we published a lot of content. We have taken an education first approach always, knowing that women are not educated about menopause. And so they go to the internet and search on symptoms. And so that's really how, for the longest time, the majority of women found us, is they were just doing their own research and they would come across Gennev in that way. Now, increasingly, as we want to we've built the capacity to support large volumes of patients throughout the United States. We are working with employers in particular, and with payers, with our partners at Aetna, to really now we're educating sales teams that are going out to their accounts to romance and showcase the fact that women can now get their menopause care covered with actual menopause specialists, not with a primary care physician or with a general practitioner. And we help them understand why that's important, why they're going to get superior care. And so really, again, our motion around education has changed. We're educating, we're training the trainer, if you will, or selling into payers, into employers. And when we have done with employers, ERG groups, employee resource group presentations and webinars, it's amazing in the chat, the volume of conversation. You often think in the workplace, women are going to be quiet, not going to bring up their symptoms. And I'm always surprised at how women come forth to share or ask questions of the practitioners that we bring to that webinar. And so women are hungry for information, and I'm just blown away at how many places we could go to go build that kind of reaction and response and bringing them to Gennev. That said, I will always say, I think we still, and I quote Stacey London when she calls women in menopause a reluctant consumer. It is absolutely true. In so many cases, it's hard to admit, and you can educate women, but until she feels quote unquote sick enough, or, wants to work with a practitioner to change her lifestyle. I know Stacey says it to me all the time. Women sometimes don't necessarily want to change the way they're eating or certain lifestyle habits. They like their lives, and knowing that once they talk to Stacey and her team, oh, they're going to be told they've got to cut this out or that. And none of us love discipline in our lives unless we reach a point of suffering so badly. And I just would love women to respect themselves and know that you don't have to make drastic changes. You can make incremental ones. And we're here and good for that too. We're not here to just tell you what you need to do. We're going to meet you where you are and bring you on that journey and just be your partner. So I hope that kind of answered your question. Obviously, we've shifted over time. We're truly focused on employers now and the insurance market.
Right. And, I think that's so important too, because you hear of so many women that leave their jobs during this time. That who did we speak with, Colleen? Here I am talking about brain fog, and I can't remember who we spoke with that was talking about brain fog, and how the woman left her job. Just said, "I'm
so many. There's a
concerned."
list of people.
Yes, but she had a job where she might have been a CFO. I'm not even sure, and that she was so worried that she was going to
accounting, that she was going to Dr. Heather Hirsch.
Yes, that it was Dr. Heather Hirsch. Yes, that she was going to make such a big mistake that it was going to really cost the company. It could even, get them into jeopardizing legal trouble and things, that she quit her job because her brain fog was so bad. And that's just one story.
Right.
And I'm sure all of you have heard that story.
Yeah.
Too many. It's just amazing.
I think the workplace is really the next sequence in the menopause conversation.
But I think with Gennev, getting out to workplaces is so important as well. And I was just reading through different things about menopause, and on your site as well, about the earlier you may go through, or if you have symptoms, is that something that you might it could increase dementia and things like that. I can't even remember.
The research that's come out.
Yes.
No, there was research that came out recently, and Dr. Dooley, maybe you can address this, about the fact that, increased symptoms, possible dementia, taking HRT, possible dementia.
Yes, HRT.
Can you talk about that?
What do you think of that?
Yeah, so I think any woman that earlier in life already had been diagnosed with premenstrual disorder, or they have really bad PMS, or a history of depression, when they go through the perimenopausal period, they are at baseline increased risk of having more symptoms, more depression, even increased risk of suicidality as they're going through the perimenopausal and postmenopausal period. So that is one thing that I tell women. The other thing is that there is some information out there that besides just the brain fog, there might be some correlation with increased dementia. And so there is no data that shows taking HRT is definitely going to help, but it can be helpful. And so I always just talk to women about that, and just let them know that, especially in those first couple of years as they're going through perimenopause, it can definitely help to protect that.
There are just so many layers. There's so many layers to this.
There are. And there's,
absolutely.
There's things coming out every day, in this space. Since Colleen and I started this podcast, the more that we've learned. And I don't know if you saw the Wall Street Journal article on Saturday about stopping menopause. I mean, I'm curious, Jill, what are your thoughts on that? I was kind of like, what?
Yeah. I've certainly followed that, especially with what the Buck Institute is doing around longevity, because they've had a bigger thesis around longevity, and obviously, the work that's being done to delay menopause and or prevent it altogether. I think it certainly is fascinating in the way that they're testing, different therapies out. I think it's really, at the end of the day, it gives every person who experiences menopause a choice, whether they want to delay it, whether they want to prevent it, or whether they want to naturally go through it and experience it. And we all have personal choices. I've heard many people say, wow, I don't need to have a life full of menstruating and periods and PMS for the rest of my life when I'm 80. Can you imagine wearing a tampon, during that time of life? And so I think, for those women that care and want to be potentially have the ability to have a baby or carry a baby, or don't want the impacts that sometimes the hormonal shifts of menopause can bring, thinning hair, wrinkles, all the things that estrogen kind of helps plump up in our bodies. I certainly do anticipate many women trying it out, experimenting, but then again, it's the pendulum swings right to left. We saw that with HRT, with the Women's Health Initiative, and now it's coming back, and thank God it is. I think we'll see some of that same dynamic with the therapies coming out around preventing or delaying menopause. It will be met with open arms by some and completely written off by others. So wait for the additional journalistic articles, I think representing both sides of the argument.
It'll be interesting to watch.
What I love is that women have choice at the end of the day. And I think that's a good thing for everybody.
That's kind of how I felt when we're reading it. I thought, I get that. I couldn't stand, the hot flashes I would get, and the night sweats and the brain fog and the sleeping, changing the sheets. But then I thought, do I want to be able to have a baby when I'm 70? But I also get it for the women that struggled with fertility. I understand, that they would want, that maybe they always wanted to give birth and they weren't able to, and maybe this would help. So I understand that. And I know that some said one was just for ovarian health and some was more for fertility. And yeah, it's just really interesting. Yeah. And I'm just going to add, and I don't really mean to man bash, but if men had gone through this would have been over with a long time ago.
100%.
That.
Yeah.
Yes.
Absolutely. And, with all of this information, because like Bridget said, the Wall Street Journal just came out with information on Saturday about another thing, and got Game 2, and all this information is being thrown at women. Gennev is such a wonderful platform to be able to go and kind of read through, dissect, talk to doctors like Dr. Dooley, talk to experts like Stasi. Jill, you've done such a wonderful job in expanding Gennev, and we're thrilled for you and for all the women that are going to be helped by the platform. We will make sure to have all the links to Gennev in our show notes. So if anybody wants to check it out, you can just go right to our show notes and click on the links. And thank you all for your time. We truly appreciate it.
Thank you. Thanks for having a platform to bring this to women. It's so needed. So thanks again.
Thank you.